Oral glucose tolerance test, the sweet detective for diabetes detection. Do you know that nearly 463 million people around the world have diabetes, and almost half of them don't even know it? Fortunately, there is a simple and sweet way to check for diabetes: the oral glucose tolerance test. The oral glucose tolerance test, OGTT, is considered more accurate than the fasting blood glucose test because it can detect abnormalities in glucose metabolism even before symptoms of diabetes appear. Welcome to our new video on the oral glucose tolerance test. The oral glucose tolerance test, OGTT, is like a sweet detective, hunting for clues to detect the presence of diabetes. By administering a sugary drink and measuring how the body responds to glucose, healthcare providers can assess the body's ability to use this vital source of energy. With the OGTT, doctors can catch diabetes early, before it has a chance to cause long-term complications. This test is a valuable tool that allows doctors to take proactive steps to protect their patients' health and well-being. During the OGTT, the patient is given a sugary drink containing a specific amount of glucose. This amount is usually 75 grams for adults and 1.75 grams per kilogram of body weight for children. Blood samples are then taken at various intervals to measure glucose levels in the blood. During the OGTT, the patient's blood glucose levels are measured at specific intervals, usually at 0, 60, and 120 minutes after consuming the glucose drink. Normally, after consuming the glucose drink, the blood glucose levels rise, and then insulin is released to help cells absorb the glucose. In healthy individuals, blood glucose levels typically return to normal levels within 2 hours after consuming the drink. However, in people with diabetes, this process is impaired, and glucose levels remain high for longer periods. If the blood glucose levels remain above certain values during the OGTT, it indicates that the body is having difficulty processing glucose and may be an early indicator of diabetes. The American Diabetes Association recommends that a diagnosis of diabetes should be made if the blood glucose level is greater than or equal to 200 milligrams per deciliter, 11.1 mmol/L, at 2 hours during the OGTT. The OGTT is considered the gold standard for diagnosing diabetes, as it is more accurate than other tests such as fasting blood glucose or HbA1c. It can detect abnormalities in glucose metabolism even before symptoms of diabetes appear. Moreover, it can help differentiate between different types of diabetes, such as type 1, type 2, and gestational diabetes. In summary, the oral glucose tolerance test is a simple and effective way to detect diabetes early and prevent complications. If you have risk factors for diabetes, such as a family history or obesity, talk to your healthcare provider about getting an OGTT. Remember, catching diabetes early can make a huge difference in your health and well-being.